I'm very pleased to introduce our next speaker, who has been a wonderful addition to our symposium in recent years. Cathy Draper has been a practicing dental hygienist for over 40 years and was a recipient of the 2020 Johnson & Johnson Award for Excellence in Dental Hygiene. Congratulations. She is really dedicated to increasing the impact dental providers can have on early detection of head and neck cancer, as well as mitigating treatment effects after head and neck cancer treatment. So, Cathy, thank you again for being part of our day.
So thank you so much, Heather, for inviting me to speak to the group this year to a topic that's near and dear to my heart, and one that I think is also really important to all of you. So with that, we're going to talk a little bit about oral health in general, because everyone came into their cancer diagnosis with a state of oral health, okay? So it's important to know a little bit of the background on, oral health issues such as periodontal disease and dental caries, and then, of course, those oral complications due to your cancer therapy, and then how to care for your mouth afterwards. So with that, looking at periodontal disease and dental disease is very prevalent in our population. Over half of the U.S. population has some sort of gum disease. So it's important to keep that in mind when we talk about complications due to cancer therapy. And then you have tooth decay, which is a different disease process, okay? It's the most common chronic disease in children and adults. And if I were to take a poll in this room, there will probably be some of you that have had tooth decay in the last 6 months, okay? With tooth decay, we know once it's established, it requires treatment. And untreated decay will lead to systemic infection. So it's really important to care for tooth decay. At the base of dental disease is plaque. You've all heard about plaque in school or from your dental hygienist, but we are building this biofilm all the time. So it doesn't matter, if you have a cancer diagnosis, you're still building up oral plaque in your mouth. So with that, you look at periodontal disease. That's an inflammatory type of infection that's going to affect gum tissue, ligaments, and bones. So it is what will eventually lead to tooth loss. So important to know, okay, that's the periodontal disease process. Systemic disease such as diabetes can really impact your periodontal health as well. So you've all been to the dental hygienist and they've measured those pocket depths. That's what they're looking at. They're measuring the distance from the top of the gum to where it's actually attaching to the tooth. So that's important to know when we talk about how we're going to direct our toothbrushing and how we clean in between teeth too. So important to kind of know the basics. This is what it looks like. And then on the other hand, tooth decay is an infectious disease process. So the two bacteria that are primarily responsible are Strep mutans and Lactobacillus. And it's also a dynamic process. So you can have demineralization of the tooth and remineralization of the tooth. It goes back and forth. And once that bacteria gets into the dentin, so the inner structure of the tooth, that's when it becomes a condition that needs treatment. But out there at the enamel edge, that can be reversed. So it's important to know that, because we'll talk about fluoride and other things that you need to do to really promote or protect your dental health. So saliva, we talked a lot about saliva today and xerostomia. So yeah, and how important it is. So you need it for lubrication. It's also a buffer. So people are not necessarily aware of the pH factor in saliva and why that's so important in our oral health. So buffering, it's also antibacterial, responsible for taste, and the early process of digestion. So, of course, when you have xerostomia because of radiation, you are really intensely aware of what happens when you don't have enough saliva. And then we've already talked about radiation and the salivary glands, but it's good to have a visual picture of, again, where they are. Your parotid gland right in front of your ear is the largest salivary gland, 25% of your overall volume, approximately. Submandibular down here, 55% of the volume. So if your radiation is here, it's really impacting that salivary gland area more than others. And then sublingual, about 10%. And then you've got minor salivary glands throughout your oral cavity. So all of those are impacted by radiation therapy. Then some things you might not know about saliva is that in health, if you were to have measured your saliva, you probably have about 500 milliliters to 1.7 liters a day. So, in health, you produce a lot of saliva. Your highest flow will be in the middle of the afternoon, but your lowest flow about 4 o'clock in the morning. So those of you that are suffering, you're waking up in the middle of the night and it's like, parched desert, right? Yeah, but that's physiologic as well as the impact of your radiation therapy. So pH, why it's really important. Neutral level, pH is 6.3 to 7.0, but acidity, your acidic pH, 5.5 to 5.0. And when your pH drops to that level, that produces an oral environment that's going to promote those lactobacillus and strep mutans bacteria. So it sets you up for decay, all right? And it's going to initiate that demineralization process. So keep that in mind. Okay, pH is important, and your pH is going up and down all day long. So when you think about that, this is kind of a neat little chart that shows you where battery acid up at the top, but stomach acid is really close, pH 1. So if you've had a lot of nausea and vomiting, it's really elevating that pH in your mouth. So if you've been vomiting, you really want to counterbalance that with some sort of neutralizing rinse. Otherwise, you've got this acidic environment that's really going to promote your susceptibility to tooth decay. So right down there, you look more towards neutral, milk. Your saliva should be at neutral level at 6. Water is 7. Go down the list, okay? So keep that in mind because that critical level for tooth decay, again, is about 5.5. So you don't have to go down very much when you're, creating this environment for the bacteria to start to demineralize the tooth. This is another great little chart because this shows you if you were to have something really, a bag of trail mix eaten in one sitting, that pH will drop down and then it will come back up, usually in about 20 minutes. But if you look at you're ingesting that trail mix all over a longer period of time, see what happens to the pH? Goes down, up, down, up, down, up. Okay? So it's about frequency. Okay? So we know after your radiation therapy, you'll have acute xerostomia, which would be partly an inflammatory reaction, and then the damage to the salivary glands themselves. We've already talked a lot about fibrosis today, and then also the alteration to the salivary gland cellular structure as well due to radiation. Where we want to look at is caries and xerostomia. So dry mouth will lead to this increased bacterial growth when you have reduced or limited salivary flow. Also, as adults, we may have exposed root surfaces. So go around the room and you may say, yes, I've got recession. You've heard that you've had recession. I personally have a lot of recession. And those root surfaces are more susceptible to the acid that's produced by the bacteria. They're less mineralized. So your enamel, hardest structure in the body, but your cementum that covers the root, much softer, which is why you can see this really, kind of disturbing picture of the root surface of that tooth. And then again, the dentition there on your right, that's an adult dentition with, it looks like some crowns and restorations. So everyone comes into their cancer treatment in a different state. If you're a young person and you've had a lot of wonderful dental care and experience, and you might come in with, 28 or 32 virgin teeth that have never had any restorations. So your risk factors for this kind of tooth decay are not the same as someone that's got a lot of exposed root surfaces, already has a high caries risk factor in their dental history. Make sense? Okay. So we look at the oral complications of cancer therapy. We know they really compromise health and overall quality of life. That's always the biggest thing that people will share after their therapy. Yes, I am in remission or I'm cured, but my quality of life has really been changed. So it can be short-term or long-term. Mucositis, common side effect once you reach a certain level of Gray's units in your radiation therapy, you're really susceptible to mucositis, dry mouth, tooth decay that's due to radiation, and then also the other disease process, trismus, and then osteonecrosis, all complications of head and neck cancer therapy. So with that, let's look kind of at the mouth care basics. So general guidelines. You want to be brushing gently and regularly, both while you're in therapy and then after. Especially, with the dryness that you have, the inability to really clear all the food particles from in between your teeth, then you need to be prepared for special measures. So again, soft toothbrush, and soft really means soft. So if you had a chance to come by my table, you could feel the difference in toothbrush quality. So you really want the really fine, soft bristles. And brushing after you eat. So, normally back in, before the pandemic and before you were at home all the time, you probably were only brushing in the morning and at night. So you want to be brushing more frequently, like after each time you eat. And then rinsing with water when brushing is not possible. And then this is a question that comes up a lot. Okay, manual versus power. It really depends on you and what you're comfortable using. So you can learn how to manipulate your brush, and just like you learn how to drive a different type of car. So you want to make sure that whatever you use is soft, small enough to fit, and effective for getting around the gum line. So some people with neuropathy aren't able to tolerate one of these sonic toothbrushes. It vibrates too much. So don't feel like, oh, I'm a failure. No, there are lots of different products to use, and the idea is that you are using them correctly for the product. Okay, so small, soft bristle brush, let it dry between use, replace it frequently. Consider buying your brushes in bulk because, hey, you'll look at your brush and think, oh, this is getting a little ragged, a little bent around the edge, but are you going to run out that night and get a new brush? Probably not, okay? And a lot of people tend to use toothbrushes way past their use-by date. So if you've got a a storage of them, then you're able to easily replace. Then the other is cleaning in between the teeth. All right, I'm not going to, yes, floss is up there, but floss is only one option. And remember that. There's all types of products that you can use to clean effectively in between the teeth. So small, fine brushes, little rubber tips, or water flossing. Okay, the idea is to think of it, I've got to clean that space in between my teeth, and there are lots of ways I can do it. Then, toothpaste. I mean, if you look at the oral care line in Target or wherever you buy your products, it's all about the toothpaste. Not so many options for, other products, but lots of toothpaste. Remember, toothpaste doesn't disrupt that biofilm. It's mechanical action. But your toothpaste is a wonderful chemotherapeutic. Use one that has fluoride if you're able to tolerate fluoride, because fluoride will strengthen the tooth structure. Look for toothpastes that don't have sodium lauryl sulfate in them. SLS is a foaming agent, but it is associated with mouth sores sometimes. So sometimes you might be really sensitive to that in your product, and you should look for try things that don't have SLS in it. Okay. And prescription products. So toothpaste from Prevalence, they have 5,000 parts of fluoride, over 1,500 in over-the-counter. They're easy to use, and you just brush it on, spit it out, and you've given yourself a fluoride treatment. You can try fluoride trays. A lot of times people can't tolerate those because you're holding them in your mouth a long time. So your dental hygienist or your dentist can put on a fluoride varnish, really easy to do, and gives you extra protection. Moisture. Rinse often, use water. Avoid mouthwashes that have alcohol, because alcohol will be drying. And then saliva substitutes. There are lots of products on the market. No one size fits all. We've already talked a lot about eating, and there's some great information out at the table from the nutrition department at Stanford. So knowing what works for you is really important. Sore mouth, using baking soda, great neutralizer, can be very soothing. Dry mouth, again, you've all experienced this, so you're going to look for what works best for you. And products, make sure that your products are not taking you into that negative pH. Read the label. Make sure they don't contain sugar. Altoids does. High-risk habits, anything that's going to stick to your teeth and anything that's going to lower your pH. So be aware. So if you're eating these products or using these products or eating puddings, make sure you're able to rinse and do your oral care afterwards. So osteonecrosis, some of you have experienced it. You would be working with your healthcare provider here regarding treatment, and you know that it can happen at any time. And we won't go into the details on that because I want to be wary of my time. Trismus, if your speech therapist has given you exercises, you want to be sure you do them. All right. And as we already said, it's that 3-finger opening that you want to have as your goal. And daily exercises are so important. Regular professional care is important. Maintain the recommended regimen, and then collaboration with your cancer team. Make sure that your dental care providers contact your team here at Stanford, and then look for that caries risk reduction. Looking at fluoride products again, that can be professionally applied or what you do at home. And things that have xylitol are really important as well because they can help reverse the sugar metabolism. So gums and lozenges, so xylitol products, important as well. periodontal or gum disease, know that you have some really wonderful products that you can use. So prescription rinses like chlorhexidine or anything over the counter with essential oils, acetylpyridinium chloride or hydrogen peroxide can be very helpful for your periodontal disease issues. And last would be dental care, especially in the era of COVID-19 when people are concerned. It's really important that you keep your regular professional oral care. Use those protective, the protective factors in your dental practice should be in place for screening patients. They should be limiting time in those common areas. You want to ask if you're concerned about the ventilation. And if you're really concerned, then ask for an appointment at the beginning of the day. And in the end, I think it's so important as a takeaway to have collaborative partnerships between your cancer care team and your oral health care providers. So anytime there's a question, you get your providers in touch with each other so they communicate. So on that note, I know I kind of raced through a lot of those points, but if you ever have any questions and you want to contact me directly, you can do that. Okay, thank you so much, Heather.